Hi, my name is John Oliver, and this is the exercise client prescription presentation for SPES440 Advanced Exercise Testing and Exercise Prescription at Kansas Wesleyan University for Professor Brian Minnick. To begin with an introduction, the principles of exercise training include specificity, overload, progression, initial values, inter-individual variability, diminishing returns, and reversibility. Exercise prescription is an art. As exercise specialists, we take into consideration all these principles, but it is not our, complete reasoning behind the prescription. There are a lot more variables that go into an exercise prescription besides just, plugging in numbers to formulas. For this reason, an exercise specialist needs to be creative and flexible. Programs are going to change per client, and it can even change throughout the prescription. A client may want to switch gears to a different exercise, and the client's goals, behaviors, and responses to exercise all need to be taken into consideration. Each client is going to have different goals. They're all going to have different behaviors, different ways that they react to motivation, and they'll all have different responses to exercise when it comes to, the amount of soreness they have or, the amount of sweat they produce. My client for this presentation is CJ Crater, who is a 21-year-old male, 5'8", for height, weight 190 pounds. His resting blood pressure was 108 over 68 millimeters of mercury. His resting heart rate was 62 beats per minute. No congenital heart disease risk factors or any special considerations for this client. CJ was a former baseball player at Kansas Wesleyan University. For the past 2 years, he has been a assistant baseball coach on the team. CJ has been an athlete his whole life, so he has had extensive experience in physical fitness when it comes to working out, whether it be resistance training, aerobic training, flexibility training, or balance training. He was very experienced in the weight room and knew basically, everything that was kind of needed for, basic safety in the weight room. CJ has been out of lifting for a couple years just because he's not a player anymore. He doesn't exactly have the expectation to lift anymore, and that can be very difficult for somebody to want to continue to work out. So CJ's goals were to improve his upper body strength, improve upper body hypertrophy, and increase his overall flexibility. For me, as the exercise prescriptor, this meant that I needed to assess the client's current strength, assess his current flexibility, and find an avenue to include aerobic training in his prescription. He primarily was interested in resistance training, but I knew it was going to be important to include aerobic training as well. So for the pre-test results, before any assessments were conducted, a 2018 PAR-Q Plus medical history questionnaire, coronary heart disease risk profile, lifestyle questionnaire, and informed consent were all completed with no follow-up. For his cardiorespiratory pre-test, his resting blood pressure again was 108 over 68 millimeters of mercury. His resting heart rate was 62 beats per minute. His age predicted maximum heart rate was 199 beats per minute. This was done by taking 220 minus his age. The bulky treadmill protocol was selected for this test. For the bulky protocol, the client's on a treadmill at a 0-degree incline to begin at a 3.3 mile per hour speed. The incline is increased 2% after the first minute and then 1% for every minute until the test is basically done until exhaustion. This test is used to estimate peak VO2 max. CJ's target heart rate was 140 beats per minute, which was 70% of his heart rate max, which for the bulky protocol, it's anywhere. This is a submaximal GXT. So the heart rate is kept anywhere between 70, 65 to 85%. At the beginning of stage 1 in this test, CJ's heart rate was 100 beats per minute. It increased to 110 at stage 2, 120 stage 3, 125 stage 4, 129 stage 5, 134 stage 6, 140 stage 7, and at stage 7 he reached his target heart rate but felt that he could continue going with the exercise, so we ended up continuing it into stage 8 where he achieved a maximum heart rate of 143 beats per minute, and then at 9 minutes the GXT was terminated due to the client becoming fatigued in his legs. After this, a proper 3-minute cool down was put in place to bring the heart rate down, which was recorded at 105 beats per minute. And the following graph shows the heart rate versus the METs for each stage of the GXT. For those that aren't aware, METs, or metabolic equivalents to exercise, are an objective measure of the ratio of the rate at which a person expends energy relative to the mass of that person during activity. Basically, it's the amount of energy you expend during activity. So, for example, 1 MET equals 3.5 milliliters per kilogram per minute. This is the basic energy requirements we need when we are just sitting down and not performing anything. For the muscular fitness, a 1 rep max bench press test and 1 rep max leg press test were both conducted. CJ's 1 RM for bench press was 180 pounds, and his 1 RM for the leg press was 410 pounds. According to page 170 in our textbook, the ACSM provided some instructions for 1 rep max testing, which were followed for this test, and these include the client warmed up by completing 5 to 10 reps at 40 to 60% of his 1 RM. He then rested for 1 minute, which was followed by 3 to 5 reps at 60 to 80% of the 1 RM. CJ then rested for another 2 minutes before he attempted his 1 RM. We eventually had to continue increasing it until we eventually reached 180 pounds, and according to the textbook, the increases should be anywhere from 5 to 10% for the upper body and 10 to 20% for the lower body. A rest of 2 to 4 minutes was taken between each 1 RM attempt, and 3 to 5 trials were conducted before we took that 180 and that 410 respectively for each test. For the body composition assessments, a skin fold was taken first. The Jackson and Pollock 3 site was used. This used the chest, the abdomen, and the thigh. This was used according to table 8.3 in the textbook, which is the prediction equation for white men aged 18 to 61. A BMI chart was used to basically assess or estimate CJ's BMI, which was 29.5. I forgot to mention CJ's estimated percent body fat from skin fold was 10.5%. His waist to hip ratio was measured by measuring the waist at the narrowest part of the torso, and then dividing that number by the hip circumference, which was measured at the level of the maximum extension of the buttocks, which came out to be, or estimated at 7.08% body fat. Bioelectrical impedance analyzer was also used. This estimated CJ's percent body fat at 14.1%. And then another interesting measurement that was used was an A-mode ultrasound. This is a tool that has recently been brought to Kansas Wesleyan. I personally have had extensive experience with this tool and felt I wanted an extra body composition assessment on CJ. So the body metrics system was used for CJ's ultrasound assessment, and his estimated body fat was 20.7%. The first picture that you see on your right is the equation for the skin fold, and the bottom picture is a look at what the screen produced on the computer for CJ's ultrasound measurement. For flexibility, a standard sit and reach test was administered. For this test, a sit and reach box is used. The client sits on the floor with the knees extended and the soles of the feet against the box. The client reaches forward, keeping his knees extended, arms evenly stretched, and hands parallel with palms down. This position is held for about 2 seconds, and the score is the most distant point reached, and 2 trials were conducted for this. CJ's best one was 29 centimeters. A skin distraction test was also used. For this test, a mark is placed on the midline of the lumbar spine at the intersection of the left and right posterior superior iliac spines. A second mark is drawn 15 centimeters superior to that first mark. The client then flexes the lumbar spine. These marks will actually move away from each other as the client bends forward, and then a tape measure is used to measure that distance. So CJ's skin distraction was 8 centimeters, which placed him above the norm. A back scratch test was also used. For this test, the client reaches over the head with and down the back with one hand while reaching around and up the middle of the back with one hand, kind of in a motion with one hand over and one hand behind. It was done both right over left and left over right. CJ's right over left was 0 centimeters and 3.5 0 inches and 3.5 inches based on the ruler that was used. The 0 represented a perfect touch of the fingers. Meanwhile, the 3.5 centimeters determined there was a gap. For the balance test, a unipedal stance test was used. The client's dominant leg was determined to be his right leg. The client stood on this dominant leg and raised the opposite foot near his ankle. For this test, the client basically just had to balance on one leg. This was done both with the eyes open and the eyes closed. For his eyes open trial, he achieved a perfect 45 seconds. For his eyes closed trial, he only achieved 13 seconds, and 3 trials were taken for each of these. Now we get into CJ's resistance training program. This program was a mix of upper body and lower body exercises. CJ's goals were to increase his upper body strength and hypertrophy, but also to maintain his strength in his lower body. He had a great 1RM on his leg press, so it was important not to just focus on the upper body, but also maintain the strength of the lower body. This program was done for 8 weeks. The intensity was increased from 70% to 80% over the 8 weeks. The weight was progressively increased, anywhere from 15 to 5 pounds of an increase over the weeks. The reps decreased each week as the intensity increased, and this was based on table 6.13 in the textbook. Each rep was correlated with a percent 1RM, which helped determine the weight that was used, because a estimated 1 rep max was completed or was determined for each exercise in the program. The sets were kept at 3. This is according to ACSM guidelines that 3 sets of anywhere from 8 to 12 reps are great for strength and hypertrophy training. Rest intervals were kept anywhere from 2 to 3 minutes depending on the intensity, and this was prescribed for 4 days, 4 consecutive days each week, and or 4 non-consecutive days each week, as CJ took a day of rest in between. All the exercises range from free weights to exercise machines. It was basically anything that was available in the Kansas Wesleyan weight room, which was utilized. For CJ's aerobic program, this was completed for 4 weeks at a moderate intensity. The percent VO2 was at 70% at about 6 METs. The target heart rate was kept at 140 beats per minute. His RPE was only between 3 and 6, so a very moderate intensity. A pace of 18.4 minutes per mile. I basically challenged CJ to go out and run 2 miles, which would have burned 7.7 calories per minute. This was done 4 times per week. It was done on days when he wasn't doing the resistance training program, there was only one day where, he would do both resistance and aerobic training. And now into the flexibility program. Flexibility was another goal of CJ's, so the flexibility program incorporated stretches for both the upper body and lower body, specifically in the lower body. The duration was kept for 20 seconds from weeks 1 to 4 and 30 seconds in weeks 5 through 8. The reps were 5 for each week. The total time was between 100 and 150 seconds each week, so it provided him great opportunities to increase his flexibility in both the upper and lower body. When it came to the post-test results, sadly, due to the COVID-19 outbreak, post-test results were unable to be recorded. Had there been an opportunity to do post-test assessments, all the pre-test assessments would have been all of the post-test assessments would have been identical to the pre-test assessments. This is incredibly important for validity and reliability, as you want to perform the same test that you did in the beginning to see where the client's at. If you do one test in the pre-test and choose to do a different one in the post, you may not gain a real understanding of how the client improved if you're taking measurements from two separate tests. I mean, there's nothing to really compare it to, even though they may measure the same things. It's important that you stick with the same test that you did for the pre and the post. Based on CJ's adherence to the program, I believe it could be reasoned that he would have shown tremendous improvements in muscular strength, muscular hypertrophy, and flexibility. Again, the frequency, the intensity, the time, and the type of exercise that CJ did were all based on guidelines from our textbook when it came to meeting CJ's goals. CJ verbally expressed to me that he felt stronger and more flexible after the exercise prescription. He, was very, very adhering to it, never had any problems. For future reference to, continue to see improvements for CJ, the frequency, intensity, or duration could be modified as CJ continues to progress through new gains. To conclude, designing exercise programs is not easy and is a continual learning process. It was difficult, at the beginning to try and design these programs for CJ because there were a lot of factors, whether it be, would CJ like the exercises? Would he adhere to it? Am I prescribing the right sets, the right intensities? There's a lot that goes into that aspect of it, but the important thing to remember is, this is a continual learning process. The first program that you create is certainly not going to be the last, and is basically something to continue to build off of, because there are going to be so many programs that are going to be created throughout our lifetimes as specialists. Again, CJ was very motivated and greatly enjoyed the program. He was a phenomenal client to have. This has actually opened up a lot of doors to future programs for myself. My parents, my siblings have both expressed interest in me creating programs for them. They saw what I did with my client and said, "Can you do this for us?" So I will actually be creating more programs here in the coming weeks for my family. Hopefully, once the virus is over, we can, hopefully adjust those programs to maybe, a little bit more variability with the types of exercise. But, I feel very confident with the skills that I've gained from this project to continue to build on building programs. I would again just like to say thank you to CJ Crater for being my client for this exercise prescription. He was phenomenal, and I'm so thankful that he saw improvements. I'd also like to thank Professor Brian Minnick for the opportunity to do this assignment and actually get hands-on experience with working with clients. It was a very valuable experience that I will certainly cherish going into my professional career.